Okay, my name is Amanda Jett, and I'm going to be doing a head-to-toe assessment. My volunteer here has emptied his bladder and put on a hospital gown. We've also taken his vital signs, height, and weight. By general inspection, he looks to have good hygiene, appropriate interaction, and steady gait without any acute distress. So I'll go ahead and start with the head, and upon inspection, the skin appears to have no lesions and looks symmetrical. Eyes and ears are both aligned bilaterally, and no visible skin lesions, moles, or rashes on the face. We'll go ahead and palpate the scalp, and the skin moves freely over the scalp. There's no excessive dryness. The hair feels smooth, not too coarse or too dry. If I could have you clench your teeth for me. Okay, good. Smile, kind of are. Squeeze your eyes shut, real tight, real tight. Wrinkle your forehead. Very good. Stick your tongue out. Very good. And puff out your cheeks for me. Great. Okay, now I'm just going to have a feel on your face. Any tenderness here?
No.
Here? Tenderness here?
No.
Okay. Very good. Can you open and close your mouth for me? Excellent. Thank you. And then close your eyes. And which side am I touching you on?
Left.
Uh-huh.
Right. Left forehead.
Mm-hmm.
Right cheek. Left cheek. Right forehead.
Very good. Very good. Okay. Onto the eyes, which appear symmetrical bilaterally. No visible discharge. Conjunctiva looks clear. Look up for me. Very good. It's pink, moist, and intact. Any tenderness here? Just want to palpate the lacrimal apparatus. No drainage or signs of inflammation or infection there. Go ahead and grab my light here, and we'll have a quick look inside your eyes. There we go. Okay, just look straight here. Okay, now look straight at the light. Excellent. Okay, back to the point over my shoulder. Good. Excellent. And follow my fingers. Alright, extraocular movement's intact, just far lateral gaze here, and then nystagmus. The other way. Alright, very good. I'm going to have you refocus on a point over my shoulder and cover one of your eyes for me. Very good. Okay, now continue to focus on that same point and cover the other eye. Okay, good. And once more, back to the original eye. And there were no corrective movements that might suggest strabismus. Both eyes were midline the entire time. Let's have a deeper look into those eyes here. Okay, just going to take a quick look right at the light. Good. Okay, very good. Red reflex in both eyes. Onto the ears, and placement looks aligned, both sides bilaterally. They look equal, symmetrical, no skin lesions visible. The pinna feels appropriately flexible, no nodules, no lesions, lumps, or bumps. We're going to go ahead and take a look. Okay, if you could turn your head that way for me. No obvious external trauma to the ear canal here. Tympanic membrane is pearly gray, no cerumen. That's very good. And then go ahead and turn the other way for me. And tympanic membrane is also visible here as a pearly gray, no trauma to the ear canal that might suggest inflammation or infection. Close your eyes for me and repeat the words that you hear me say to you.
T7M.
Uh-huh.
T9.
Great job. Thank you. Just making sure that you can hear a whisper. A couple more hearing tests, okay? I'm gonna bounce the tuning fork off my hand and then place it in the middle of your head, and I want you to tell me if you hear it better in the right ear, the left ear, or the same in both ears, okay?
Same in both.
Okay, very good. Now, once again, go ahead and just tell me when you hear the sound and when it disappears. I'm gonna place it behind your ear here, okay?
Okay. Okay.
All right, very good. Once more for the other side. You ready?
Mm-hmm. Okay.
All right, thank you very much. It's good. 2-to-1 conduction. And we're onto the nose, which appears midline. The skin is clear, dry, and intact. No discharge, no lesions. The septum appears midline. No sign of a deviated septum on either side. If you could just close one nostril for me and breathe. Good. And the other side. Okay, both nostrils are patent. And we're going to have a quick look inside those nose. Okay, there we go. No discharge. Nasal turbinates appear pink, moist, and intact. Septum is free of any lesions or trauma, also pink, dry, and intact. Okay. And this side. Okay. Nasal turbinates are visualized, pink, moist, and intact. No septal trauma and no sign of any lesions inside there. The lips appear symmetrical, pink, moist, and intact. No signs of infection or inflammation there. I'm gonna have you open your mouth for me, okay? There you go. Real wide, say ah. Okay, uvula is midline. The tonsils are symmetrical bilaterally, no exudate. The buccal mucosa is pink, moist, and intact. Teeth appear to be in good dentition and hygiene. They are white and no signs of plaque or cavities. If you could take your tongue and touch it to the roof of your mouth, the floor of the mouth and underside of the tongue is visualized. No obvious varicosities there. I am noting the number of teeth. Good. If you need to close your mouth and swallow a couple times, that's fine. Good. Okay. No foul breath noted. And I'm going to take one more look here. Good. The gums appear pink, moist, and intact, in good contact with the root of each tooth. No sign of gingivitis or anything like that. Okay, last time we're just going to test your gag reflex. I'm sorry. Sorry. I didn't warn you about that one, huh? Okay, moving right down to the neck, which appears smooth and symmetrical, smooth and supple. If you could turn your head to that side for me. No jugular venous distension. And then back to me. Great. And if you could turn your neck side to side again to my resistance. Good. Back this way. Good. And then tilt your head back and forward. You do a shoulder shrug. Excellent. You can do better than that. There you go. Very good. Very good. Turn your head once more to that side. I'm just going to feel for a carotid pulse. Rate is regular in rhythm, no thrills felt there, pulses are 2+. Back the other way for me. Get your other carotid one at a time. Good, right, regular rate and rhythm. Can you put your chin up for me? Trachea looks to be midline, and upon lateral inspection, the thyroid does not appear to be enlarged. There's no evidence of a goiter. Very good. We'll just have a quick feel for your lymph nodes, okay? Preauricular, postauricular, occipital, submandibular, submental, anterior cervical, posterior cervical, deep cervical. Good. Take a deep breath for me. Supraclavicular, infraclavicular. Good. And lift your arms. The axillary. Good. Thank you very much. Just going to have a quick... Have a quick listen. You can turn your head to the side for me. And then turn your head back this way for me. No carotid or thyroid bruise heard. And then moving on down. Shoulders and arms all have good muscle tone. We'll check the brachial pulse. Good. The skin appears clear, dry, and intact. No rashes, lesions, or open sores. Radial pulse and brachial pulse are both 2+, regular and symmetrical from side to side. Temperature is nice and warm. Don't notice any edema. Fingernails appear clean and no signs of clubbing in the fingernails. If you could hold your arms up like this for me and don't let me pull them out. Good. And squeeze my hands. Very good. Perfect. And onto your back. So if I could just have you remove your hospital gown from the top and have you face this way. Very good. Just gonna have a quick look over the skin, over the back, and I don't see any lesions or rashes, no obvious masses. The thoracic configuration looks symmetrical. Respirations appear regular, equal, and non-labored. No signs of any distress. You're gonna feel right here the crossovertebral angle on both sides. Okay. Any tenderness? No? No tenderness there? Okay, very good. Take a couple big deep breaths for me, slow and even. Good. The thoracic expansion appears symmetrical. Every time I place my hands on your back, if you could just repeat the phrase 99 for me. Good. All right, very good. Now you can just breathe regular. The lungs sound resonant throughout percussion and are symmetrical and equal bilaterally. We're going to do the same thing to the sides here just to make sure the lateral lung sounds clear. Okay, very good. Now we'll go ahead and measure the diaphragmatic excursion, which is how high and how low your diaphragm rises. So go ahead and when you're ready, take a big deep breath and hold it for me. Good. Okay, good. Now let it out. Thank you. And when you're ready, take a couple normal breaths and then blow out all your air and hold it. All right, you can go ahead and breathe regular. And we are about 3.5 centimeters on both sides and equal bilaterally. And while I have you back here, we'll go ahead and take a listen to your lungs. Every time the stethoscope presses on your back, go ahead and just take a deep breath for me. Okay, very good. You feel okay? All right, I'll go ahead and have you spin around back towards me so I can see the front part of your chest. And I'm going to inspect the skin over the front part of the chest, which looks clear, dry, and intact. No rashes or lesions visible. The thoracic configuration looks symmetrical from the anterior surface as well. Respiration still appear regular and non-labored, possibly a little bit faster now that I've made him take some deep breaths. I don't see any visible pulsations or heaving, no lifts. Just going to palpate the precordium here. And I still don't feel any pulsations, heaves, or lift. And the apical pulse. Okay, very good. We're going to repeat actually the phrase that we did last time, the 99 phrase, as I move top to bottom on your back. We're going to do that in the front here too. So just repeat the phrase 99.
99. 99.
Very good. Okay, that feels equal, symmetrical, both sides. And just going to have a quick listen here, and then we'll move on to the heart, okay?
Sorry.
Big deep breath every time my stethoscope touches your chest. Good. Good. Very good. Now you can just breathe normal, okay? Here we go. Very good. Resonance percussed throughout, which is normal and symmetrical from one side to the other. We'll go ahead and listen to your heart. You could lean forward just a little for me. Good. Very good. No gallops, no friction rubs, no murmurs. The rate was regular with an audible S1 and S2. If you could go ahead and lay back for me, we'll move right along to the abdominal assessment. Okay. I'm just going to inspect the skin over the abdomen, and I don't see any obvious protrusions, masses, or lesions or rashes here. Okay. I'm going to go ahead and listen before I do anything else for bowel sounds in all four quadrants. Very good. Irregular but equal and auscultated in all four quadrants, which is good. Tympany throughout. Let's see if we can find the dullness from our spleen. If you could move that arm to the side for me. Okay. And we're going to find your liver here. We are about 6 to 7 centimeters. Very good. Now you're going to feel me push on your belly, okay?
Mm-hmm. Good.
Take a deep breath. And let it out. Okay. Take a deep breath. And let it out. Abnormalities, no masses palpated, no aortic aneurysm suspicion there. Good. And if you could just put your chin to your chest and flex your abs. Very nice tone, symmetrical on both sides. Great. I think we're through with the abdomen. We're going to move right along down to your legs. Let's have a look here. You can sit up if you like. The hair distribution on the legs appears normal and symmetrical both sides. And open your legs for me just a little bit. Feel the popliteal pulse. Symmetrical on both sides. Temperature feels warm and equal on both sides, and there's no evidence of pedal edema. I'm going to assess the posterior tibialis pulse on both sides, which feels symmetrical on both sides, and the pedal pulse, which is also a 2+ and equal bilaterally. If you could, don't let me pull your leg out, okay? Keep it in. Good. 5 out of 5 strength. Very good. And then do a toe push down and pull up towards your nose. Good. And this side. Very good. Up towards your nose. Excellent. And while we're down here, we'll go ahead and have a look at your reflexes. Okay. A little tap here. Good. You can just relax. Good. Okay. Very good. Thank you. And the Achilles. Very good. And while we are down here, I just want to check your sensation from the bottom up. So if you could tell me this is hard and this is soft, close your eyes and then tell me which one you feel.
Soft. Hard. 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 Soft. Soft. Hard.
Very good. Thank you. So we'll just go ahead and check your brachial reflex here. Just let your arm relax. Okay, good. And this side. And let the arm stay nice and relaxed. Excellent. Thank you. Okay. If you could stand up for me, the last part of the test is just to assess your lumbar spine. I want to make sure that you're still on the camera here. There you go. Go ahead and bend forward and touch your toes. Very good. Spine looks symmetrical and midline here. And stand up for me. Okay. And go back as far as you can. Should be about 30 degrees. Excellent. Even a little more. And do a trunk rotation for me from side to side. And then your neck, chin to chest, all the way back, side to side. Any tenderness there? Any feelings of lightheadedness or dizziness?
Mm-hmm.
No? Okay. Well, I thank you very much. I think this concludes my examination.
Yeah.
Thank you.